Hello everyone, I am Dr. Megha Saroha, Senior Consultant in the Department of Pediatric Hematology, Oncology and Bone Marrow Transplant at Dharamshila Narayana Hospital, New Delhi. So today I will be discussing about bone marrow transplant. So what exactly is a bone marrow transplant? Bone marrow is the soft tissue in our body where healthy blood cells are formed. All three lines of blood cells, that is RBCs, WBCs and platelets, are formed in the bone marrow inside the long bones of our body. And what is a bone marrow transplant? So in some children, the bone marrow gets diseased or it does not function properly. So the bone marrow from a healthy donor is taken and infused into the patient so that the patient's marrow also gets healthy and starts recovering. So this procedure is referred to as bone marrow transplant. Bone marrow transplant is conducted in three basic steps. So first step is known as conditioning. In conditioning, the patient is given chemotherapy, which helps in making space for the donor marrow to come, and it also helps in removing the diseased marrow. Second step is referred to as infusion, in which the bone marrow cells are infused into the patient's body just like a normal blood transfusion. Third step is referred to as engraftment and recovery. So in which the cells of the patient which have now taken, the donor cells which have been infused start to repopulate, and this is referred to as engraftment, which generally takes at least 2 to 3 weeks. Now, what are the types of bone marrow transplant which can happen? So basically, there are two types of bone marrow transplant which take place. First is referred to as autologous, and second is referred to as allogenic. In autologous transplant, the patient's own bone marrow cells are taken and stored, and then high dose chemotherapy is given, and these cells are again given back to the patient only. This procedure is generally done in few solid tumors and in lymphomas. So, solid tumors commonly neuroblastoma, high risk neuroblastoma, or maybe Wilms tumor and Ewing sarcoma also. Second type, and the most common type, is allogenic transplant, in which the healthy donor cells are taken and then infused into the patient. The healthy donor can either be the sibling of the patient or a related family donor, or maybe an unrelated donor as well. And it can be a full match, or referred to as a full match sibling, or a full match family donor, or it can also be a haploidentical or a half match donor transplant. There are various indications of allogenic transplant in children. Firstly, they can be cancerous indications, in which certain types of leukemias, that is blood cancers, in which we have to do an allogenic bone marrow transplant. Or it can be non-cancerous conditions such as aplastic anemia, in which the bone marrow in the patient's body does not form at all, or maybe thalassemia and sickle cell anemia, in which a dysfunctional bone marrow is there. In all these conditions, bone marrow transplant can help them recover, and a healthy bone marrow can be given to the patient. To conclude, bone marrow in children is a very complex but a life-saving procedure which can help many patients recover from their disease.